What's going on, family? We are officially on the journey to 1 million subscribers, and my team and I are giving away $30,000 to help you pay off your consumer debt. That's right. 3 E3 community members will each get $10,000 to wipe out their consumer debt. Now, do you want in? It's simple. All you have to do is subscribe to my YouTube channel and join my email list by going to AnthonyONeal.com and clicking on the Join the Community tab. That's 100% it. Check this out. At 940,000 subscribers, we're surprising one lucky person live on my show with the first $10,000, and we're going to give that person a financial makeover before paying off their debt. So, before we get to today's show, hit that subscribe button and let's hit it 1 million strong before my birthday, July 1st. All right? Love you all. Let's get to the show. What's the point of getting out of debt, gaining all this wealth, but then you're not living long enough to actually enjoy it? Black men, we are 16 times more likely to get prostate cancer.
So that wealth means nothing. If you're diagnosed with cancer at a young age and you have this wealth, what does that mean? Because that money is not going to buy you feeling better.
You have people that will go out and buy a Louis bag, a Louis Vuitton, get Louis Vuitton shoes, and haven't seen their doctor in 5 years.
You want a provider that actually is passionate about what they do.
Just because you don't feel it doesn't mean it's not killing you.
Correct.
Right.
Hypertension.
Because here's the truth, at the end of the day, it doesn't matter how good your doctors are. When God says this is your time, it's your time. But my thing is, I don't want to go home and see him until he said it's my time. Can I be honest with you, Anthony? I say, yes, sir. You'll pay for a Louis Vuitton shirt. I'll pay for a Louis Vuitton life. That's exactly what I was thinking in my head, right? I was like, that's what rich white people do. Y'all, today's show is going to be a fun show, but a very informative show, man. When I turned 40, I really wouldn't say when I turned 40, this really became a major issue to me. I would say right around 32, 33, my dad went through something very major. Actually, I'll just say it. He went through prostate. He had prostate cancer. And the doctor looked at me and said, hey, man, this runs in your family, and you should get checked. And one thing I've learned with African Americans, we always say there's 2 things we don't talk about in the house, which is sex and money. I think there's 3, health, right? We really don't have the proper information being taught to us on how to be healthy. So this channel is all about building wealth, right? How do you avoid debt? How do you, become that millionaire that you want to be? But what's the point of getting out of debt, gaining all this wealth, but then you're not living long enough to actually enjoy it? We have my 2 personal doctors in the building today who have, we're going to talk about their situation, that if you're in the DMV area, this would definitely be something you want to look into because they are only in the market and they are very, very good and very, very knowledgeable. And here's a plus, these are Black sisters, all right? But they were telling me before we started shooting this show that Black men, we're at the bottom when it comes to living. Our average age span is at 65, and I think Black sisters are right around 70 plus, a little bit right over there. But then Black men, we are 16 times more likely to get prostate cancer, and 60% of Black women are obese. And my thing is, man, if I'm gonna help us build wealth, y'all, we're building wealth so we can leave an inheritance to our children's children. I wanna see us leave wealth, and I want us to die when we see great-grandchildren. And we gotta do that by just taking the time to make sure that we're properly doing something. And so I want to introduce to you all for the very first time on this platform, but definitely not the last time. I've already told them that Dr. Thompson and Dr. Lewis, they will be coming on the show. I'm gonna try and get them on at least like every other month. These 2 sisters are busy because what they do, we're gonna talk about what they do. They're very, very busy, but I want to make sure that people within our community, we're getting the information and we're living as long as possible. And so I want y'all to really focus on this one, focus on this conversation. Take some notes, pause, do some research, and then also as well at the end of this show, we're going to put all the information of how you can connect with them. They have a special event coming specifically for ladies, but brothers, I'm going to tell y'all right now, I think we need to slide in the back and just listen as well. All right. And brothers, if you love the woman who you with, just get them a ticket to this virtual event and say, baby, I want to bring this to you. Now I'm gonna let them tell you how to do it, because I think sometimes we could do that and ladies get offended. What you trying to say? You know. So y'all help me welcome to the table for the very first time, but not the last time, my dear friends, Dr. Thompson and Dr. Lewis. What's up, ladies?
How are you?
Man, listen, let's get into it. Let's get straight into it. So, Dr. Thompson, I've seen you 2 times now as my primary.
Yes.
And I have a membership with you all. I need to do one more form, but I have a membership with you all, and I want to start here. This show is all about wealth, right? How important, though, is our health when it comes to our wealth? What would y'all say about that?
If you're diagnosed with cancer at a young age and you have this wealth, what does that mean? Because that money is not going to buy you feeling better. You know, you can pay for the top doctors, the top medicines, but that may not mean that you're going to overcome that prognosis. So it's very important to consider health from the inside out, not just how we look, because aesthetics is so big in our community right now. It's all over social media. So it's important for us to really tap in to go outward.
Yeah.
Dr. Lewis, you and I were talking about this within your practice, I think, before y'all started partnering, or even while you're doing that too. You get into aesthetics.
Right.
But I think sometimes within our community, please correct me if I'm wrong.
Okay.
We are so much into aesthetics, but we forget the health part of things.
100%. So
How do we balance the two, right, to where we are aesthetically pleasing, but we're a little bit more healthier than just aesthetics?
Right. So it goes back to what you said about wealth, right? So everybody's definition of wealth is different.
Okay.
Right. And so for me, wealthy, I want to make sure that I am also the health piece, right? So that goes to memberships and things like that. You have people that will go out and buy a Louis bag, a Louis Vuitton, get Louis Vuitton shoes, and haven't seen their doctor in 5 years. That person is wealthy, but are they really wealthy in the sense that, right, their physical wealth, right, is also important. And so in our African American community, I see people that are dressed from head to toe.
Facts.
Right?
Facts.
Looking very clean, and the inside is not well.
Ooh.
Right? Their A1C is elevated, going to prediabetes and diabetes, or they have high cholesterol, or their thyroid is off. And when those things are off, can you really live your best life? Are you really the wealthiest person that you can be individually? I'm not talking about just money.
Yeah.
And so that comes back to introspection for people, right? Making sure that you're getting to your doctor or finding a physician that you feel like you trust, that you can talk to, come see us, right? Like you're doing, and us working out a plan for you.
Yeah.
So you can be not only wealthy on your financial side, but also wealthy and healthy on the inside.
You said a key word there, though, plan.
Plan.
If I'm being honest, I was fearful to come see someone like you. Because one of my family members said, yo, when you go to the doctor, please understand this. They will find something.
Yeah.
Like, they're going to find something. When he said that to me, I think that was the worst thing he could have said to me. Because that's where he left it. They would find something wrong with you. I was sitting down and I was talking to Dr. Thompson, because she's been doing a lot of my stuff. And I told her I was about to go to see a very well-known doctor who examines your entire body head to toe. And it was honestly my president at Virginia Union University who was like saying, Anthony, you're doing a lot of great things. Bro, I need you to live long.
Yeah.
So I need you to come see this doctor. He's like, but hey, check this out. He gonna find about 10 things wrong with you. He didn't leave it there though. He said, but he can fix it. He said, what is better is if he find a cancer thing in you that's forming very small, the difference is that's a pill. If it's big, that's radiation, right? So he was like, would you rather take a pill? Or would you rather do radiation? And I was like, nah, that pill. He was like, so you need to get on this list and you need to come do this. And then I mentioned it to you and was like, no. You ain't going nowhere else.
Right.
We got you.
Correct.
Why are we so scared to come and sit down with y'all?
The truth hurts.
Yeah.
Right? You comb through individuals' finances, right?
Yeah.
You're going to find something.
That is true.
There's other things that we comb through and we find out. We clean out our closets and we find things, right? But it's time to clean out the closet to get healthy, right?
Good.
Because the prevention is the cure. That's the part where you have to get over. Like, there's fear in a lot of things that we do. We have anxiety associated with a lot of things, but we have to get over those anxieties in the Black community. We have to be a part of the discussions of health because the disparities are only going to continue to grow. The numbers we talked about in the beginning of this, it's going to continue to grow. And if we don't get in these conversations, if we don't build these communities, then that fear, it means nothing if we're not really doing that prevention, that preventative work.
So good.
I would even take it back to historically, right? Why our fear comes from, right? So we look at the Tuskegee studies, Tuskegee, Alabama, where African-American males were given the placebo for syphilis, right? And then they watched things to happen over them over decades, right? So that fear kind of goes back into that. Also, you look at Henrietta Lacks. They took her cells, right? I would encourage people to look at her story, right? You don't hear enough about it with the breast cancer cells and things like that, and the uterine cancer cells. I think those stories, we've heard of those like anecdotally throughout our households. And so it's like, oh, those things happen to those people. I don't want to get tested because I don't want to be a lab rat. I don't want to be a test dummy. And so that fear is instilled from decades ago, and it's hard to let that go. Even when you talk to African American generation grandparents and things now, they remember those stories. And they pass it on to us, and now we're like, oh, I don't want that to happen to me. And so just taking it a step further, I feel like our generation has more access to health.
We do.
Than they did before. And access to knowledge. And information, right? And so once again, go back to what I said, finding somebody that you can trust. Right? I mean, I know you trust that guy that you got your recommendation from with your physical, but as Dr. Thompson told you, we can do those things for half the cost, right? Those things are called executive physicals, which are great when you have the money, which you do. But the average person may not have $5,000 to spend. Right? And they might only have this much to spend. And how can we maximize that to still make sure that they're healthy and getting what they need?
And I like that. Executive physical. And I want to live right there. What you all are offering, which I think is so important, is executive services right now without somewhat of the executive prices.
Correct.
Now, they're going to go up.
Okay. He's making his own case.
I'm just letting y'all know right now. In the DMV area, right now, you're getting executive. I don't know what to call it. Y'all can, you know, when I come back over to y'all can polish it up. But you all know I haven't felt well. I had something wrong with my eye, and then I was not feeling good at all. Right after the CIAA, something just took over my whole body. I remember I woke up one morning, I took some NyQuil, then the next morning God said, you need to text Doc. So I text Doc I think at about like 8 o'clock that morning. She said, yeah, bro, I got you. I see it this time. And she just is like asking me 1,000,001 questions. And this is what I like about it, because I first met her as friends with her amazing, my brother, her fiance. And she was real cool. We had a good time when we all connected. What made me stick with her was afterwards on my first visit, it was like, nah, we ain't friends. You're paying me about your body. I'm going to be very serious about that. And I mean, that style was going within 24 hours. My sickness, I mean, she just gave me the right medicine and I felt good within 48 hours. And she told me how to do it, when to do it, why to do it. And she even educated me along the process. And then she told me about a partner or something that she has going on. I was like, wait, what's this right here? So wait, you can be my primary care? Seriously? She's like, yeah, it's called the executive membership. You pay this amount and boom, it's like, you ain't got to go nowhere. We'll come to you. We'll do blood work. We'll do your physicals. We'll do all that type of stuff. And if there's anything we got to go to the hospital for, I'm going to tell you what to do, but I'm going to make sure everything else is straight. I was like, that's what rich people, white people do.
I know this.
That's exactly what I was thinking in my head, right? I was like, that's what rich white people do. Jay-Z says something right now. I got 3 people on call. A doctor, a lawyer, and an accountant.
That's true.
I have a lawyer on call. I had an accountant on call, but I did not have a doctor. I had to go to the urgent care, or I had to go to an ER.
And wait for hours.
Yeah. And I would go to the same urgent care person to see the same doctor, right? But I'm like, dang, I got to sit in there for 3-4 hours.
Sometimes 6-10.
Exactly.
And hurting.
You know, let me tell you something. Here's an embarrassing story. I told my doc about it. And this is why it's so important. And I'm being vulnerable here, all right? So y'all don't be laughing at me. Don't even be judging. I'm just being real of why it's so important to make sure, 1, you're educated. And then 2, you got a right doctor. 2 o'clock in the morning, I wake up one morning and I go to use the restroom. Doc, you don't know about this one, so I'm talking to you.
I'm getting the story now, so I'm listening.
I wake up in the morning at 2 o'clock in the morning.
Okay.
Did I tell you about this?
No.
I didn't?
No.
I'm sorry. Then I talk both of y'all.
Here we go. a consult.
The closets are being opened.
Yeah,
right?
yeah.
Come
So
into
wait
the
a minute.
Y'all
closet.
not here.
2 o'clock in the morning. Okay. So mind you, that same week, okay, I was with Dave Ramsey, and we were out on the lake for 8 hours
Oh.
straight. Okay. So this was like a day before then. Wake up at 2 o'clock in the morning, literally about, say, 36 hours later. Go to the bathroom, and as I'm walking through, I see in the mirror that I literally have skin falling off of my back.
We did talk about it, but we didn't go into detail.
Yeah, okay.
This is the detail.
This is the detail. So I'm like, I freak out.
Okay.
I'm 29, 30 years old at the time, I think. And I'm like, the heck is this? I mean, skin is just falling off.
Yeah.
And I ain't talking about small. I'm talking about you seeing. It's
Chunks.
like I was Snake.
Yeah.
I was like, what the hell? Oh, shoot. So I pull up my phone and I Google
That's what it is.
what happens when you see skin falling off your. The very first thing comes up, HIV/AIDS.
It's gonna tell you dying. That's what I'm trying to tell people.
It's 2 o'clock in the morning. It's 2 o'clock in the morning, y'all. And I see that I am dying.
It's like, who are you gonna call?
I'm like, who am I? It's 2 o'clock in the morning. My daddy's asleep. My mama in California, she about to go to sleep. I go to the emergency room. Not even lying. And I'm getting in there, and it was like, what's the problem? I'm dying. I got skin falling off. Google said I got AIDS. I need an HIV test right now. Doc come and say, well, have you been sexually active? I was like, no, I have not been sexually active. That's the thing. What the heck is going on? And I'm thinking in my head, who gave me AIDS?
Oh my God.
I'm going back through all my partners, and I'm like, but she cool.
Oh my God.
She loves the Lord. What happened? I'm not even lying, and I laugh about it now, but I was not laughing then.
The fear.
Doc comes in, he looks at it. He said, well, son, I don't know. I mean, we could do an HIV test for you right now. We could run your blood, make sure you're straight. I was like, run the blood.
Yeah.
Run the blood. So he runs the blood, comes back. Mind you, it took me 4 hours to get to the back.
Mm-hmm.
I did not get to the back of the
whole
urgency
time.
care until 6:15. Then to run my blood was another hour.
And you're like going
And
crazy.
I'm going crazy. So at 7:30, Doc comes in and says, well, I got good news, I got bad news. What do you want? I said, Doc, give me the bad news, man. I'm thinking he about to tell me you got AIDS. And he says, well, the bad news is this hospital visit is going to cost you close to $2,200.
Correct.
I said, that's the bad news?
Yep.
Yeah.
But you have waited all that time.
I said, what's the good news? Yeah, son, you ain't
To find out.
got no STD?
Right.
I was like, so what I got? A sunburn. I said, sunburn? That's all it is? I said, but I thought black people can't get sunburn.
Definitely can.
Miss.
He said,
Definitely.
he was a white guy. He said, well, sir, respectfully saying this, everybody can get sunburn.
As long as you have skin.
As long as you have skin, exactly what he said. He said, now white people, we are more prone to it, right? Because of the
skin.
melanin of your skin, you're not going to see it as much, but your skin is still burning, but because you're melanin, you don't see it as much. But you told me you was out there for 8 hours with no sunscreen. He was like, so that's the reaction of no sunscreen.
Exactly.
And you was going to in and out the water? I was like, yeah. He said, so when you got out the water, your skin was burning even more because of the water.
Yep.
And he was like, so I'm so sorry that you didn't get a bill and you waited here for almost 6 hours for me to tell you this. And the thing is, I'm like, I paid $2,200 to go to the emergency room. By joining your program, I could have called. I can't call her in the morning. Her fiance would have cussed me out.
You can at least text us.
I'll text you. You know what I'm saying? I'll text. See you in the morning. Turn around. Oh yeah, Ayo, you got a sunburn.
Yeah.
And give me my I got to pay my fee. You know what I'm saying? And then I get the cream because he gave me some cream to put it back. And I'm like, so when I weigh it, even when I was really sick, the last time I called y'all, that fee compared to going to an urgent care or emergency room
Bar none.
is there's no comparison. And watch this, I felt better because she also educated me on how I got it and why I do it. Prime example, which is why I like, y'all, this is so important. The nasal spray. I didn't know how to properly do it. She trains me right on. She was like, hey, don't just shoot it up. You want it to hit this area. And I was like, well, nah, but I was going back. I was leaning like this all the way over. They told me, and I'm like, that's all I had to do is that. So, I mean, the education that comes with y'all, It's just amazing. But I want the people to know, what exactly do you all offer in a DMV, and why is it important for us to get it? Specifically Black people. All my white people, hit them up too, but Black people, get them busy first. Anyways, what is the name of y'all's program, and why is this important?
So our business is called PatientWell Connect, and we established in 2023. And one of the reasons why we established is COVID happened, right? And so with that, one thing that we both realized is that people don't always have access to their providers in a way that allows you to build a relationship with your provider. Currently, with insurance, you have to wait long, have these long waits. It's a 20-minute visit or a 10-minute visit, providers on to the next one. With us, we wanted to create a unique experience. And unfortunately, you do have to pay for unique experiences. We pay for unique experiences in other sectors, right? Nice. So it's important to do the same with your health. And so with that, we offer membership-based plans for patients to see us in addition to insurance. But we push our plans because it allows you to have more access. It allows you to have a better relationship with us. Because the insurance companies, they require us to see something like 20 patients in 8 hours. I was in those spaces and I had to remove myself from it because it was becoming too much on myself, right? Wow. You want a provider that actually is passionate about what they do. So for me, I had to really make a big decision on, okay, I have to transition here. Same thing with Dr. Lewis, and I'll let you talk, Dr. Lewis.
So like my colleague said, was in that space for a while, and it was very, we call it burnout, right? Where, and everybody can get it in any space they're in, but for the medical space, it's a little different. As she said, they ask for volume, and you don't get that time or build that relationship that you want, right? And that's so important. And so I like to think of our services as like a doctor in a box, right? You're able to get your labs talked about, right? Bring your questions. Research things. Like you were saying, hey, I need to do my own research. Research things and bring questions to us.
Correct.
So we can talk about it together and have a plan together. So we offer the labs, we offer physicals, home visits, weight management. So weight management, semaglutide, tirzepatide. I know there's a lot of controversy around that. Peptide therapy, we do Botox and fillers. So a little bit on the inside and out, mostly on the inside though, right? Because that's the focus for trying to get back people's health together, people's health in general together.
Also injectables, IV hydration, B12 injections.
All right, fam, let's have a heart-to-heart. You all know that I'm all about helping you get your money. But let me ask you this question. How's your credit report looking? And if you're being honest and you're saying, you know what, Ayo, I need some help, well, listen, I got something for you. Listen, I know credit can feel like this big, confusing thing, but with Kickoff, it doesn't have to be. They've designed a super simple, affordable way to help you build your credit, whether you're just starting out or need to bounce back from a rough patch. Here's how it works. Kickoff reports to the major credit bureaus to help you establish a positive credit history. And you can get started for as little as $5 a month. No credit check, no crazy interest fees at all, no hidden fees, just a straightforward way to improve your financial standing. And here's why it matters the most, because it is not just about a number, it is about financial freedom and doors opening up for you. Do you want that dream apartment? Do you want lower car insurance and even better job prospects? It all starts with making sure you have a good credit profile. So don't wait. Head over to AnthonyONeal.com/kickoff. That's AnthonyONeal.com/KIKOFF and start your first month for just as little as $1. Listen, it's AnthonyONeal.com/kickoff, KIKOFF. You get it for $1. Let's get you some lower rates, especially in 2025.
Hi, beautiful people. I'm Dr. Lewis Everett, and this is Dr. Thompson, and we are PatientWell Connect. Join us as we do Soft Girl Era, Heal, Thrive, Glow, our wellness webinar on March 28th at 6 p.m.
This webinar is something you don't want to miss. It was designed just for you in mind. We'll be talking about all things wellness holistically. And from the inside out, it's important to understand how we can heal, how we can thrive, and how we can glow. Just like we talk about finance, we talk about health, and that is our wealth. So we want you to join us on March 28th at 6 p.m. to talk all things wellness so we can heal, thrive, and glow together.
You all are only licensed in the DMV area, right?
That's correct.
Okay, for right now.
And Florida for me.
And Florida for you.
This is we want to expand, but
we're taking our time.
We're taking our time.
I ended up getting it with another venture that I was in.
One thing that I feel that was real good that you all said is that, and I didn't know this, that which I'm not knocking doctors because we all need access to some form of a doctor, right? But sometimes we do feel rushed when we're in the doctor's office.
Yeah.
And it's because you all got to get through all these clients from an insurance perspective. And then what you all are saying is like, hey, we're passionate about this, but we don't want to be drained. So you're going to pay a little bit extra to get us, but you all are passionate about it, right? Y'all, and their services is not expensive. How much y'all service, the membership?
The membership is about $150 a month.
Say that, whoa.
$150.
$150?
50.
Yo, let's be real. We'll spend that on food in 2 days, eating up.
Yes.
And you trying to tell me you can have a personal, private doctor who is not slammed with a whole bunch of clients, who genuinely cares about your life and can help you out, help you live longer for $150 a month?
And if you think about what you're paying for insurance every month through your provided plan, you're paying sometimes $150 twice a month, or $250 twice a month. You're going to the urgent care, you're dropping $500, $1,000 just to go to be told you have a cold.
Yep.
Listen, man, I'm just trying to tell y'all, the membership is good. It's only $1,800 a year. Is that per person? Let's say this person has a family, husband, wife, 2 kids. What is that?
Per person.
Per person, $150 per person.
And I mean, if you're able to sign up in the next day or so, we can offer pricing packages with group packaging. Because again, we're passionate about what we do.
We're gonna put it inside the show notes. And I'm serious. I need my E3 community. I need y'all to sign up. Like, I don't get paid off of this. The reason why I'm having them on the show is because I've personally experienced them for a while. And it feels so good to know I could be out on a speaking engagement and I can call Doc and she can tell me what I need, and then she can send the meds through wherever I'm at. Yep. And for me, as I have a family, Doc, my son is sick. My son can stay in the bed and Doc can just come to the house. And watch this, to me, I'm not knocking the race, but I do feel better knowing it is a Black person, and on top of it, it's just something about a Black woman, because a woman's gonna come with that nourishment, and then she's gonna come with the doctor on top of that. Like, she's gonna know everything about it. Like, she's gonna know how to make you feel better, because she's a woman. That's what they want to do. But then she also has the wisdom, the knowledge, and the backing to make sure that you feel good on the inside. Now, one of our shows that went viral was Dr. Bobby. And he talked about, what did he talk about? What are we talking about?
Ozempic.
Yeah. So he's on the opposite side and he says, hey, this is not healthy for you. Right. And here are all of the risk. What's y'all's thoughts on that?
So first off, let's even get in this step first, take a step back.
Yeah.
So a lot of doctors push none of this medication because insurance does not cover it. So let's even start there.
Okay.
Out of pocket, Ozempic is about $1,000 out of pocket.
$1,000 what?
$1,000 for 4 weeks of medication. Okay?
What?
Same thing with Mounjaro and Zepbound. Zepbound is more expensive now, right? Because it's coming FDA, the whole thing. I'm sure people have seen the ruling. The whole thing now, scarcity. But the Mounjaro is about $1,500. And so I feel like you have a lot of doctors like, no, don't buy it. Just do this diet, vegan, Whole30, vegetarian. And I'm not saying don't do those things. Right. But we are seeing, especially in our communities, a lot of people with what we call metabolic syndrome. Yes. Cholesterol, diabetes, high blood pressure, thyroid issues, PCOS.
What is PCOS?
PCOS is polycystic ovarian syndrome.
Okay.
A lot of females are starting to see that they have that. Okay. Even skinny females. Everybody used to think it was only females that were obese. We're finding that it's a spectrum, right? And so they have a lot of issues with prediabetes and high cholesterol as well. Okay. And so we recommend it because we want to prevent those things, right? Okay. Or help to at least tame those things. Okay. Right? And so those medications do that. Okay. And so every medication has a risk.
Yes.
Every medication does.
Yeah.
But also being morbidly obese carries a higher risk.
Ooh.
And it also carries a risk of stroke and heart attack.
Yes.
Which these medications have been, evidence has shown that they actually reduce what we call MACEs, which are adverse cardiovascular events. Okay. Right? It's been shown to reduce those. Okay. And so I've had patients be on the medication because their insurance doesn't cover it. And I've put them on a compounded semaglutide or tirzepatide, and it's reversed their prediabetes and their high cholesterol with 1 shot a week.
1 shot a week?
1 shot a week.
And y'all would deliver that shot? Or
Yeah, we would order. We can deliver it for you. We can do it for you, or we can send it to your home.
Okay.
And the other component of that, as you mentioned, he's more so focusing on plant-based, right?
Yes.
So one thing we encourage, oftentimes patients are having fatigue, they're having all these symptoms and they don't know why. So we would do a comprehensive workup. Functional medicine is something that's really popular right now. So when we do that deep analysis. We're not just looking at your A1C. We're not just looking at your cholesterol, but we're also considering some of the other hormones like cortisol, insulin, because then we're able to understand what is going on in your body chemistry, right? And so from there, we can get a comprehensive plan. What diet do you need? What supplements do you need? Because it's not a one-size-shoe-fits-all. It's not just meds. It's not just exercise. It's not just diet. It's a combination, and also mind, body, spirit, right? There's so many components. And so we could speak to that doctor and say, yeah, it's important that we change our diets, but there's other things in our lifestyle that we change. And so the medications can sometimes bring us to the weight numbers we want, but then from there, we do the other comprehensive items to keep you healthy.
If Black men are dying at 65, then that means at 40, at my age right now, I'm on a downturn. And that's scary to me because it's like, if I don't take my life serious, all the wealth that I'm working hard to build right now, I'm not going to be able to really enjoy it. And that frightens me a little bit, because it's like, how many other of us who are watching this or listening to this, how many of us are the same way? Like, we're not taking our health really seriously. We got this whole, like, everyone trying to be a vegan. And I'm like, vegan? Like, that's not going to guarantee you lasting. You know what I'm saying? It's like, nah, get into the doctor, get in to see your primary care and do that executive test, right? And for me, the reason why I was willing to spend $5,000 was because I'm like, that's me. But if I can do it cheaper, I'm gonna do it cheaper. Right. But it's like, if I need to know what's going wrong with my body, because there's something going wrong in my body that I do not know because I do not feel it. And one of the things I really felt spiritually was, just because you don't feel it doesn't mean it's not killing.
Correct.
Right.
Hypertension.
Right.
Hypertension.
Yes.
Hypertension. It's a silent disease.
Some people.
It's a silent, right. There's not always symptoms associated with these conditions. It's not always symptoms. Silent diseases, right? They walk around and they don't have a face. And so it's important for us to do those screenings, because the latter, right? Like the fears that you have.
Oh, yeah. And the fears are real.
The fears are real.
I'm not excited about doing all this work with you. Like, I'm not excited. Like, there's two things I'm not excited about. When I sat down with my attorney and did my estate plan.
Well.
You know what I'm saying? That wasn't exciting because we're talking about my death.
Yeah.
And everything that's in that estate plan does not benefit me at all. You know what I'm saying? And then when I come to y'all, it's like, I'm going to be losing sleep until I get my test to be like, okay, what's wrong with me? Just keep it above. And then my homegirl did it. She said, yeah. She's like, yeah. And she had to go back to the doctor. Oh, we got the test results and we need you to come back in. And she said, Anthony, that was the longest drive ever.
Yeah.
And she's like, but it felt good to know, okay, these were the things that are going wrong with my body. Yeah. Here's the medicine. Hey, you need to change your diet. Hey, you need to fall back on these things. Hey, you need to add this in. But the doc said, congratulations. She's like, congratulations. Yes. You caught it before it became something big. Yep. And so she was like, hey, yo, because I was talking to her, just laughing with her. And she was like, yes, it's going to suck. She said, but what sucks even worse is when you can't when they're giving you medicine to just prevent the pain, not to heal you.
Right.
So it's like pretty much just saying, hey, you're dying. But you're just going to die a little bit slower with less pain.
Yeah.
And she's like, I don't want that kind of medicine. I want the medicine that's, all right, we caught it. This is what we got to do to get it going, to remove it. And here are the steps that you need to play. Here's the plan that you need to take to make sure that this doesn't come back. And you got to come in at least 2 or 3 times a month. I'm curious right now, medically wise, some people say it's best for us to go and see you all once. My dentist says, man, if you really want to keep your teeth clean, she said, I'm gonna tell you something that most doctors won't tell you. From a dentist perspective, come in once a quarter.
Yeah,
I agree.
Absolutely.
If you want no cavities, no nothing, come in once a quarter to get your teeth clean.
Yeah.
Because you can't brush, no matter how you brush, how many times you floss, even if you come in here every single year and brush every single day and floss every single day and only see me once a year, I'm going to catch something. You may have a cavity.
Yep.
You could do everything right.
Yep.
She said, but sometimes a cavity just gets in places that you just as an individual can't get to.
Exactly.
But if you come to me every quarter, I can see when a cavity is starting to form.
Absolutely.
And I was like, word? So what would y'all say from a body perspective? How often should we be seeing you all and having this conversation?
I think it's individualized. It's individualized by age. It's
Okay.
individualized by your chemistry and your body, your makeup, right? Because when we do your initial valuation, we can then determine a plan
Okay.
on how often that is. Now, when we're getting up in age, we should be getting screenings. And so I'll let Dr. Lewis talk even more about the screenings, but as we reach certain age groups, there are screenings we should be getting. We should be doing EKGs by age 40.
Okay.
We should be looking at our A1Cs starting in our 30s and our cholesterol panels, pre-diabetes.
Okay.
And then there's also just specific gender screenings that we need.
Yeah.
But I would say, just like you said, you can't get to that deeper cleaning if you don't get those regular screenings. And so it's so important that we're doing that.
Yeah. Well, shout out to my dental colleagues at first, because dental health is actually associated with cardiovascular health. The worse your plaque is, it increase your risk of having a heart attack. Increase your
worst?
the
Oh.
worse your plaque. So like somebody with severe stage 4 gingivitis, plaque issues,
Yeah.
increase your risk of having some type of cardiovascular event. Mhm.
What?
Yep. So shout out to them for teaching that, right? Like every quarter,
Did not know
get
that.
your mouth clean.
Yeah.
Because they have to do, then we have to take over and treat your endocarditis and treat everything else that we have to do on our end. But before it even gets there, you can do your part by brushing your teeth and going to the dentist. So let's just, let me put that
That's a
out
part
there.
of screening.
So shout out to them. For the
Absolutely.
ADA.
But you know why the reason why Black people don't go? Because they don't have the money.
Right. It's the dental insurance coverage thing. I know too. But anyway, like she said, with the screenings, some of the screenings that we also see are you need to get your mammograms for Black women, mammograms 40. I even recommend sometimes younger than that, depending on your family history.
History, okay?
Colon cancer, right? All of us know what happened with Chadwick. All of us know what happened with Chadwick. And he was 45, right? And they pushed down the age to 45, but what is it? It's funny because my husband asked me this. He was like, so he was diagnosed when he went for his screening. Yeah,
Because he went too late.
correct. But it was like, that was the recommended age, was 45. See what I'm saying? So it's like, so even looking at things like that, if it runs in your family, you
Right.
really should be doing it before 45. It used to be 50 and 55 for colonoscopies. Prostate cancer, we already talked about that with your
That's
dad.
me. Mm-hmm.
I do PSAs on my Black males, then their late 30s. I don't wait till 40.
Right.
It's recommended to wait
In the
till
40s, yeah.
But the
right.
risks are higher.
Insurance, right? But the risk is so much higher
Why
that
not
I don't
do it
wait.
earlier?
I don't wait.
It's just
because
a blood
I've caught it.
test.
I've caught it a couple times.
It's just
And
a
people
blood
that were
test.
37 and 38.
37, 38.
Early on, stage 1. Yes.
And
And stage 1, is that surgery or is it medicine?
That's just medicine. That's just medicine.
Okay.
What I am starting to see though is some African American males are getting, or men in general are getting prostatectomies because we can do them more efficiently, and the recovery time is not as bad.
What was that? Break that down for us.
So a prostatectomy is essentially where they remove the prostate or certain pieces or
Certain
parts of
pieces.
the prostate
Tissue.
Yeah.
where the cancer, right, where the tissue where the cancer is, right. So
Okay.
they'll do something called a Gleason scoring, where they take a core biopsy of
Okay.
your prostate, right? It's 12 cores.
Yeah.
And based on, and they do an MRI of your prostate as well.
Right.
And based on that, the surgeon then determines if they have to remove the complete prostate
Okay.
or just a little bit or
Okay.
just pieces. But now they have a radical robotic prostatectomy where you just get like 2 little slits in the abdomen
Okay.
and then they remove that piece. So it's much easier, less recovery time.
Yeah.
So a lot more men are deciding to go that route as opposed to doing what we call Lupron therapy
Okay.
to help reduce the risk of the prostate cancer and treat it. Yeah, so.
But the simple test is just a blood test.
Right. I know I'm giving all these technical terms, everybody, but you know,
Just do
before
a
I
blood
even
test.
get
Just
down
a blood
that
test
blood
is initial screening. I mean, that's for women, it's easier than what we have to go through, right? For our mammograms and pap smears. But for men, it's initial
blood.
screen is just blood work.
Not even the prostate exam, the rectal exam anymore. A
Right.
lot of my men, they're like, oh, you gotta put your finger, I'm glad your fingers are small.
So now we can do prostate check with just blood?
Yes.
Unless we have to do, it's very rare now that we have to do like a full prostate
DRE.
exam.
Yeah.
Yeah, DRE. That's awesome.
How much does that stuff cost? Like for males to do like a blood work, stuff like that. What's like ballpark?
Well, it depends. I mean, if you're using your insurance to do blood work, say we send you to a Quest, most blood tests for a comprehensive package, you'll probably spend less than $100.
Wow.
Yeah.
So less than $100. You can get all the work, and you can call me and tell me what's wrong with me.
Yep.
And what to do.
We could start there.
She said we could start. I didn't say that's all.
Vitamin D deficient, vitamin B12 deficient. I mean, it's a whole workup.
It's a whole work.
Yeah. And when you look at functional medicine, oftentimes we're not just looking at values to be normal. We're even looking at suboptimal levels. So even if it's getting a little bit low, we're managing it before it gets too low. Because oftentimes in traditional medicine, you're managing it once it's out of normal range. You're not even looking at suboptimal levels.
I got to ask this question. It's a fun question. Don't say too much, though, because I want y'all spouse to get upset. Y'all spouses probably get on their nerves, huh, Lou?
Yeah. I mean,
Being married to a doctor, y'all probably... Babe, did you just cough?
my husband knows. I literally just took him to the doctor on Monday. So.
Oh, man.
Yeah, I'm constantly on my fiance
Very
about
much so.
his health.
I would be like, I love you, but babe, I just
But you know
coughed.
what I'll say, when I first started dating my fiance, one thing that actually made him more interested in me, or just, he was like, you know what, she really cares. I brought him a sick pack.
He told me that story
He
when I
was
first
sick.
met him. Yeah.
And I called and I was like, are you okay? And he's like, no, I'm not feeling well. I'm just in the room in the dark. And I'm like, I'm going to come over. So I gave him all the things he needed to take.
Yeah.
I was like, this is what you need to take in the next 48 hours, and I'm gone. And he was like, you gave me everything I needed. You babied me a little bit, and then you just left. But I was better in 48 hours.
The thing about reassurance, my husband loves the reassurance. Like, he was like, I have a doctor at the house.
Don't
Like, I don't
fear.
have to, he comes in quickly. When the thing happened with DeMar Hamlin, as soon as DeMar hit the ground, my husband was right upstairs. Hey, what happened with him? What happened? What happened? I was able to explain it before. He's like, I love the fact that I have a doctor in the house.
Yeah.
It annoys him sometimes, don't get me wrong.
It will.
But
But here's the thing, though.
he loves being able to get the
Your
answer.
fiance said that. I said, but that's what I need. So when I'm sick,
A sick pack.
just give me the sick pack. Give me some orange juice. Leave. Or if you don't leave, just leave my presence.
Yes.
Let me be sick privately.
Right.
But all this, baby, okay? Baby, you just cough. Drink some water. Nigga, beautiful.
You know, men, y'all act like y'all can't be sick for 2 seconds.
No,
Lord knows we can't leave y'all to do nothing.
No. But it's like, it flips, though. When you're sick, do y'all want your husband with y'all near y'all all the time?
It depends on what
Depends on what it
illness
is,
Yeah.
But you know, everybody gets to be a little, you're like, oh, I need
want a
space,
little
but
bit-
I'm hot.
Yeah.
I'm hot because I'm sick.
Some people want to be babied when they're
Yeah.
Facts. That is a good question. Do you self-diagnose yourself when you're sick?
I try
Or do y'all like go to
I
each
try
other
not to.
sometimes?
We'll go to each
Yeah.
other. We'll go to each other. And both of us have like our own separate doctors too.
That's good.
Who stays on? I know both of us stay on us.
Right.
Because doctors, we're not the best patients.
We are not the best patients.
For real?
Nobody in the medical
Because we know a lot, right? So then
So when the doctor tell you something, it's like, are you sure? I don't think so. And then,
7 days, I'm gonna take it in 3. No, I'm good at where we're just supposed to take it in 7, right? For antibiotic course or
Yeah.
something like that. So it is funny, but not the best. I'm not the best patient.
listen, I love it, man. I love it, y'all. Y'all, I hope that y'all learned a lot from today's show. We are going to figure out how to get them on the show in a regular, even if it's just virtual. We just bring them in, give us some tips. If you're in the DMV and Florida area, we're going to put PatientWell's information inside of the show notes. I want y'all to check out their event. We're going to put that in there too. That's going to be a great event. But honestly, more important, I want y'all to sign up for the membership. Yeah. I mean, because this is a no-brainer for the Black community. I mean, there's no ifs, ands, or buts. I've literally heard, and I say that, I'm trying to say this without saying any names. When she told me about this program, I literally said it. No, this is what wealthy white people do. I was in a room with a billionaire while we're meeting. His nurse, his doctor was in there just checking him up. Yeah. While we're meeting.
Wow.
Prescribed him medicine because he wasn't feeling well. I'm like, what the heck is going on?
Yes, it's affordable, people.
You know what I'm saying? I'm
have
like,
that same care.
Yeah, you can have those same access. It's access, right?
That's it. So when the doctor left, I said, I got to ask you a question. He's like, yes, ma'am, I'm my doctor. I was like, yes, sir. How important is it? He said, man, I love my life. He said, can I be honest with you, Anthony? I said, yes, sir. You'll pay for a Louis Vuitton shirt.
Well.
I'll pay for a Louis Vuitton life.
Ooh.
He was like, I like Louis. My wife has 2 purses.
Yeah.
But before I buy Louis, I want to live long.
Yeah.
So I'll pay He's paying his doctor $1,500 a month. A month. But that covers him and his entire family. Right? And he's older. He's in his 60s and 70s, right? And he was like, yeah, I can call him at 2 o'clock in the morning. And if it's an extreme emergency, he'll be here with the ambulance. And if he doesn't be here with the ambulance, he gonna call the hospital where I'm at and check in and make sure everything's good. And something that was so good to me, he said, man, one time he had a stroke, unexpected stroke. His primary care doctor met him at the hospital. And when the ER doctor was coming in, the ER doctor wasn't talking to him. He was talking to his doctor.
Wow.
Yep.
And I was like, he said, so when you get to that point, Anthony, you need a doctor, you need a lawyer, and you also need he said a therapist.
Yeah.
On call, right? And I'm like, okay. And I have an accountant. So right now I have an accountant on call, a therapist on call, and I have a lawyer on call. What's up, Josh? That's my guy. But I didn't have a doctor. And then when you told me I think it was your fiance who told me first.
Yeah.
When y'all was in my office, and I was like, her? Word? I said, don't play. He was like, nah, bro, she the deal, bro. And that's when he went into your story. And I said, yeah, no, I'm so serious. Like, and I remember I woke up at that start. I said, I was about to go to the urgent care. I didn't even tell you this. I got in my car to go to urgent care, got near my mailbox, and I think it was the Holy Spirit. It was like, bro, why are you not calling Dr. Thompson? And I put my car in reverse, backed all the way up. Then I had to find your number. I said, oh, she texted me like a week ago. And that was God for you to text me because I would have had to call someone else to get to someone else to get to you. You know what I'm saying?
Yeah.
I'm gonna leave that right there. That's none of y'all business, okay? None of y'all business. But it was God that you text me, and then boom, before I even get in the garage, before I even park my car and turn, I'm like, hey, Doc. I ain't called you since then. I said, Doc, I need you. I have a speaking engagement. I got the star in my eye. I need you. And man, yo, I'm telling y'all, to have this on call, and especially if you have a family, it just makes sense to know that your son, your daughter doesn't have to go around other sick people.
That too.
And sit in a room uncomfortable. They could be at the comfort of their home, the comfort of their beds for the fraction of the cost. But still getting what the rich, wealthy white people are getting.
Right.
And to me, the 150 is a no-brainer. And I've worked with Dr. Thompson enough, and I worked with them enough to understand that if they have to deliver bad news, at least I'm getting the bad news from someone who wants to help me get it right.
Right.
And it's not coming from a white doctor or even a black doctor inside there who's stressed out, who's had a long day, who's seen, 100 clients, and they really don't care. Hey, this is the problem. This is your issue. So sorry. Here's medicine. God bless you. And at least I can get a plan to make sure that I'm good. My wife is good. My kids are good. And I can live as long as God has intended for me to live. Because here's the truth. At the end of the day, it doesn't matter how good your doctors are. When God says this is your time, it's your time. But my thing is, I don't want to go home and see him until he said it's my time. Right. And so we're going to link all the information in the show notes, y'all. Wealth means nothing, practically from a money perspective, if you're not wealthy in a healthy way.
Right.
So wealth, like Dr. Lewis said earlier, it's not just about money. It is about, here's another thing too. Wealth is what you pass down. Are you passing down the correct health information to your kids? That's another question. Let's end there. A lot of my people who are watching have kids. What are some good things they could be doing to train their kids now? Like things that we avoided in a young age. What are some things, dentists, checkups, what are some things they could be doing with their kids now to make sure that they're healthy as well? Because I wish my parents would have told me go get a checkup, a physical, and really train that into me earlier on. Because you know why? Ooh, that's good right there. I wouldn't be scared today if it was normal for me to do this on a yearly basis. So y'all, you got kids?
No, not yet.
Okay, y'all want, what are y'all, I'm curious, what are you all going to be doing with your kids to make sure that they practice a healthy situation?
So I would teach my kids. So there's something called an after visit summary that you get from your doctor that kind of goes through what you talked about. There's two that goes through what you kind of talked about and the things that you need to work on. Let's just say it's high cholesterol, for example.
Yeah.
having your kids be like, hey, so can you explain this to me? Right? I just saw somebody that was 18 the other day, very knowledgeable about their personal family health. And I told them that, I was like, young man, I appreciate that you know, hey, my grandma had this, my parents have that, my sibling has this, I'm on these medications. Like teaching them even their own personal stuff so they're able to ask questions when they get to their doctor and letting them advocate for themselves a little bit, right? We do have parents, you know, they'll go in, they're like, oh, I want to speak for my kid because they're my kid and I want to protect them. I understand, but what if you're not here one day? They got to be able to advocate for themselves. That's including in the health space.
Right.
And they might be a little scared of their doctor or their dentist, but I think them having that education and knowing, it reduces that fear. It closes that gap of that fear that they have for the doctor. And they carry that with them as they become adults.
The knowledge. The knowledge is the power. Just like we share financial wealth, right? We talk about our financial wealth. So the health piece is something we need to start talking about early with children.
Yeah.
With my nephew, one thing he loves to, we played doctor when he was really, he wants to be a doctor now, right?
Okay.
Because we played doctor when he was little. But the knowledge, my sister, she's also a nurse. He sees that knowledge and he learns really early and he understands what it means to go to the doctor. And so when you're able to role play with your children or when you're able to just pass down those, because we have those fears about doctors. And so when we get past that and we find providers that we trust, we find providers that look like us, we network within our communities in those silos, and we build and promote that, then we're able to have those trusting spaces where we can share that knowledge and stay healthy.
Listen, y'all, we're going to bring them back on. I mean, there's so much we can talk about. Doc does Botox, and I be having questions about that. Like, what's the purpose of Botox?
Yeah.
But she educated me on why, but she also educated me on sometimes we do too much of it.
Yeah.
So I'm gonna leave that alone because I'm talking about me. I don't do Botox.
Not you.
And so listen, today was a great show. We went way over, but I didn't want to rush this. I didn't want to rush this one because it's needed information. And I want to make sure that as we're building wealth, as we're becoming millionaires, as we're getting debt free, as we're building this legacy plan, legacy is not only money. Legacy is health. You want your kids to live longer than you. And you want your grandchildren to live longer than your kids, right? And so how do we pass down the information and the best practices and the best strategy to live as long as we possibly can?
And Anthony, I actually want to say something with that knowledge that we talked about. We have a workshop coming up on March 28th at 6 p.m. online, easy access, right? It's called Heal, Thrive, Glow, Soft Girl Era. Men, you can attend as well.
I'm coming.
But this is a time for us to have these conversations, right? These open, safe spaces where we can have the dialogue, we can provide the education. Because sometimes when we're having the visit, we don't always have enough time to have all of the education, but here we can cover that education and you can get that knowledge that you need.
Yes.
You could even take it back to your provider and advocate for yourself when you have that knowledge.
Yes.
Yep, prioritize your peace, right?
Yeah.
Prioritize that. Prioritize your, wealth, physical wealth. This webinar is going to discuss that. We'll talk about preventive care. We'll talk about self-care.
Yeah.
Another big piece,
Yeah.
right? And holistic medicine, kind of along the lines of functional medicine.
Yeah.
So come see us. Come hear what we have to say.
We're going to put it in the show notes, y'all. We're going to put it in the show notes. And y'all, let me know. Drop it in the comments. What are some questions you all may have, right? And what we'll do is we'll shoot it over to them. And maybe we can just virtually just have them jump on and answer a couple of questions. And then we can put it on the show and then link to their practices. Because I think I want to see their business just flooded. I want to see it with the wait line to get in, because you're not going to get my spot. Because, man, I'm taking advantage of this. I mean, I know the importance of it. If all of my rich, wealthy friends have a private primary doctor, they are living longer. I'm just being honest. And they're catching things quicker and sooner. And so if we have access to this for $150, why not?
Exactly.
You know, but watch this. Only wealthy mindset people will understand the value of that. Average people say, well, I'm going to spend an extra $150 to go to my doctor.
Yeah.
Okay, go ahead. I'm not knocking you if that's what you do. But wealthy mindset individuals, you understand the importance of your health. And you understand the importance of what they kept saying, access. When you have access, get it. Because you never know when the access could save your life and change your life. And so I got access. Yo, we love you all. God bless you. And we'll see you on the next show. I'm going to see y'all too. I'm going to be on the back end of this event. I'm gonna have my screen off, so ladies won't even know Anthony's in the building. But I want to learn as a black man because I want to live longer. But sisters, y'all need to be in the building. All right, we'll put all the information inside the show notes, and we'll see you on the next show. Peace out.